A lot of my patients come to me with acne on their chest and back. Let's talk about what causes it and how we can treat it. Chest and back acne is often caused by a combination of factors including genetic, hormonal, and environmental factors. The sebaceous glands in these areas are usually larger and produce more oil, which can lead to clogged pores and more breakouts. One of the best ways to prevent and treat chest and back acne is to keep the area clean and dry. This can be done by wearing breathable clothing, showering after sweating, and using a gentle cleanser. One way you can treat chest and back acne is using products that contain salicylic acid or benzoyl peroxide. These ingredients have properties that help exfoliate the skin and prevent clogged pores. However, it's very important to make sure you're using these products carefully as they can be very drying on the skin. Another option for treating chest and back acne is to see a dermatologist. We've got many options to treat chest and back acne, including prescription creams, oral medications, chemical peels, and different lights depending on your type of acne. In addition to these treatments, it's very important to maintain a healthy lifestyle. A lot of factors can contribute to the acne, so you want to make sure you're eating a balanced diet, minimizing stress, and getting enough sleep. Remember, chest and back acne is a very common problem, but it can be prevented and treated with the right care. If you're struggling with acne, book an appointment with us at 718-491-5800 or at sinyderm.com.